Welcome to a Fuller Life podcast where we discuss longevity strategies, disease prevention, and improving quality of life. We explore the physical, mental, emotional, spiritual, and social aspects of having the life you want. Let's cover a variety of feet issues here. This will not be a comprehensive show. It just would be impossible to cover all kinds of feet problems and ankle problems and lower limb problems in one show, but I want to talk about some common ones and what we can do for solutions in the office. So first start with a disclaimer. Remember not to do anything that I discuss on the show without checking with your doctor first. If you're working with a doctor, a chiropractor, physical therapist, a chiropractor, podiatrist, whatever you might be working with, don't make any changes in exercises, nutrition, stretching, and so forth until checking with your clinician, please. We're also not developing any sort of doctor-patient relationship with this show. So as I get into the problems, we're going to cover bunions, neuromas, plantar fasciitis, turf toe. I'll talk a little bit about leg length. So these are the types of problems, neuromas for sure. I'm going to talk about these problems and what I've seen in my clinic as of recent. Let me tell you about several cases that I've had recently, what we did to address them, and then I'm going to get into descriptions of problems like plantar fasciitis and like bunions, okay? So, there's a woman that's been a patient of mine for a handful of years. She is 30 years old now, and she has a bunion. Now, if you're listening to me, you can't see me, but if you're watching me on YouTube, I'm going to use my hand as my foot. And the big toe on the inside of the foot, the big joint where the toe joins with the foot, is a large knuckle, okay? That large knuckle is where a bunion forms. And the bunion, most people know what a bunion is. It's a big bump that develops usually in the inside of this big toe area, okay? Now, again, if you're watching me on video, the big toe I'm going to represent with my index finger, that will tend to deviate outward. So if this is my foot, my left foot, as I'm facing you here and you're looking at my underside, my big toe will deviate outward. It's going closer to the second toe. That's very typical in a bunion. And then over many years, usually, extra bone is thrown in this area because the body in its magnificent intelligence and so forth is like trying to stabilize this area and try to make it easier for you to propel yourself around to actually walk. So for a lot of people, this does develop over time. Now, this woman's only 30 years old, and she started to develop a bunion. It's not huge yet, and it does bother her somewhat. Okay, so we're catching it early. Now, she came in to see me for spinal problems. Then she asked me about the bunion. We started taking a look at it. We're managing it really well. It's very minimal in its impact on her life right now. So what I'm doing in her case, I do adjustments, meaning I adjust the joints of her foot, just like we work on joints of the spine as a chiropractor. And she's working with toe spacers. I'll talk about these a little bit more in detail. So if you're looking at my hand, if the toes are all crunched together, we can put a little gel spacer in between, let's say, the big toe and the second toe. And that's going to start moving the toe into a better alignment. So that's one thing that these toe spacers do, okay? That's above and beyond, let's say, the socks that have the individual little toe channels in them. This is something more meaty. It's going to be, let's say, an inch thick, and it's going to really start to separate those toes. So she's doing that. I'm doing adjustments in the office. I'm doing a little bit of soft tissue work. She's doing some exercises at home, more on that in a little bit. And she's definitely starting to pick better shoe wear. And just to introduce you to that, the shoe wear that we're talking about are shoes and sneakers with wide toe boxes. Now, a wide toe box shoe is different than a wide shoe. Wide shoes have been around for many decades. But we're talking about a wide toe box shoe. Some or many of you might already be knowing what I'm talking about. You kind of know them when you see them, whether it's a dress shoe or a sneaker. You can actually tell that the toe box, the area of the shoe where your toes are, is simply wider. Okay? For decades, unfortunately, we had pointy shoes, whether it be sneakers, athletic shoes, or dress shoes, that are just too pointy, particularly women's shoes, but also men's dress shoes. And now those toe boxes are starting to widen up. So just make sure if you're going to start looking at what I'm describing here, you're going to get specifically a wide toe box shoe. You need to make sure that those words are talked about. Okay, there are many companies and makes and so forth of these shoes, and it's growing all the time, which is really wonderful. Okay, so she's doing really well. She's not completely discomfort-free, but much, much better, and I think she's going to do really well for a long time to come. The second one, this one is some time ago. This could be 15, maybe even 20 years ago. A middle-aged man comes into me with big toe pain, one side big toe pain. Okay. The instant diagnosis that anybody would make would be gout. Okay. Gout was already ruled out. Now, this is before he saw me. He had big toe pain, went to his doctor, they did blood work and so forth. They ruled gout out, but nobody could figure out what was going on. Ends up in my office. Somebody probably sent him in. And so I asked him, hey, how, I examined the foot and the toe moves around completely fine, full range of motion, no pain, press, push, prodded, twisted, no pain in his toe. Okay. I move up to the lower back. I said, how does your lower back feel? He said, fine. I move him around and so forth, no back pain. Okay, so follow now. No back pain, only big toe pain. I start working on his asymptomatic low back, and his toe pain went away. Pretty cool little story. So I'm just throwing that in there to say sometimes a foot issue can be coming from elsewhere, and oftentimes a foot problem can be a foot problem, and we just need to try to figure that out, okay, as a practitioner. Yep. Next one. Just recently, a couple weeks ago, a friend texted me and said, can chiropractic help neuropathy? Now, I'm not going to get into neuropathy in detail. Again, too big of a subject, but I will make some comments about that in a moment. She said, can chiropractic help neuropathy? And my response was, it depends, right? So we ended up having a conversation, and after I peppered her with a bunch of questions, we found out it wasn't the neuropathy that she was using the word for, and I'm thinking neuropathy like the bottoms of both feet are numb, or she's having pins and needles and tingling in all the toes, and it's starting to move into the foot, and that kind of thing. That's more of what the word neuropathy is. We nailed it down to it was on one side, and it was only between two toes, and it was between the second and the third toe. Now, I haven't even seen her yet. But I said, it kind of sounds like to me like a neuroma. Okay, so let me just bring that into the discussion here. So a neuroma is a word that means that there's an inflammation at some nerve endings, usually in between a couple of toes. So you think of the knuckles between two of the toes rubbing together. Imagine us stuffing our shoes in narrow toe box shoes, and our toes are just simply friction, rubbing back together. There are tiny, delicate nerves in between those knuckles. And every time we rub on them, the nerve is getting irritated, inflamed. The body, in its amazing capabilities, throws in some scar tissue around there to try to protect the delicate nerve. It's almost like a callus on the skin of your foot, but in this case, it's a callus around the nerve called a neuroma. I said, I think this is a neuroma. So then we went into it, and I said, I want you to get toe spacers. And I want you to get this thing called yoga toes, although you can get a different brand as well. And if you've ever been to the spa and you've had some work done there, you'll have all of your toes spaced out at one time, right? So you can actually buy these on your own, Amazon or whatever, and you can get these toe spacers that go in between all the toes. Now, you wouldn't put shoes on after that. That's something to do when you're at home outside of shoes. So you put it on there for periods of time during the day. Let's say it's 3 minutes, 5 minutes, 10 minutes, whatever it is. So you start to do that to allow those knuckles to open up and take some pressure off of those nerves and that callus. Next, as during the day, you can put one of those toe spacers in between your toes to keep a little bit of space. And I gave her the recommendation of getting wide toe box shoes. So that. And then I told her about some specific exercises. By the way, on my video page, my YouTube page, if you go to Dr. Scott Fuller in YouTube, We've got 300 plus videos on there. And if you search for feet, you can either go to YouTube and put in Dr. Scott Fuller feet, and I have 2 feet exercise videos. One is focused more on plantar fasciitis, but the second one has a variety of feet and ankle exercises, just wonderful base exercises that you can do. I gave her those. And within a week, she's already feeling better. She's like, this is wonderful. I already been checked out. Nobody knew what was going on. They didn't know what to do with me. And now she's doing well. Okay, so this is a case of neuroma. By the way, I have multiple patients with neuromas this year doing better with the care that I just laid out for you right there. Okay, not everybody responds to neuromas in there, but there we go. In the office, I also use a cold laser or low-level laser. More on that in a few minutes. Okay. Next, I have a woman who's been a patient of mine, we'll say 6 or 7 years now. She's in her 70s, and she came in to me because she has back and leg pain. Okay. So we're doing really well there. We're working her posture. She's super fit. She walks a lot for exercise. She's doing resistance training. She's into yoga. She's paying attention to her diet. The one missing thing was spinal care. She came in for spinal care. She's doing great. But then she told me about this old Achilles tear that she had when she was younger, like I think a teenager or her early 20s. So 50 years ago, right? And she tore her Achilles badly, but surgery was not needed, according to the orthopedic at the time. They said just kind of let it heal and you should be okay. Fine. So it healed well, but it still does bother her. It's tight. It's stiff, right? So I start, even though this isn't really, it's attached to the ankle, so we can put it into the feet problem category. I start doing some light soft tissue work on this Achilles, and it's doing amazingly better. So the point of this story is 50 years after she had this old chronic problem, she happened to mention to me. I started working on it, and boy, she glad she did. I'm glad she did. We gave her relief 50 years later. So the point is, it's never too early, and it's never too late to start working on things, right? Okay, that's pretty cool. Not promising that somebody with a 50-year-old Achilles problem is going to get better, but there's a case of that turning around nicely. Okay. And the last case I wanted to talk about before we get into these situations here, actually a couple more. One is my mother. So when my mom and dad split, mom had to go back to work. Mom goes to work retail. And this is back in the high heel shoes days. So she's wearing high heel shoes, stuffing her feet into these pointed torture devices called shoes, right? On her feet 12 hours a day, 14 hours a day for years. At the end of her life, the worst complaint in her body, and she had many, knees and spine and neck and all kinds of stuff, the worst complaint she has was her feet. She started off with really flat feet, so she already had some problems going into the high-heeled shoes, but the shoes definitely destroyed her feet. And anytime I would see her and work on her, the first thing I would do is start working on her feet, just to try to give her even momentary relief because her feet were so bad. And we did a variety of things. We worked with podiatrists and orthotists for specific orthotics, and I'll touch on this in a few. And so we selected certain footwear that she could handle, and then we had custom orthotics, so we had to find orthotics and shoes that matched. And anybody that's been down this rabbit hole, you know what I'm talking about. So we just tried to support her as well as she could, and then I gave her a variety of treatments that I could offer as a chiropractor. So we were really managing her feet as best we possibly could. But that's what happens if we, number one, don't pay attention to it and work on our feet enough. And number two, really bad shoe wear can just be totally destructive for somebody and really ruin our quality of life. Okay. And then myself. So myself, I was going to a chiropractor all through grade school and high school. And I was going to be a runner. I was a runner in high school, still am now. And my chiropractor pointed out, oh, you've got really flat feet, which I do. They're flat as a board. So if I was to be in bare feet right now, without shoes and socks on, you would see basically my medial arches, the big, long inside arch of the feet here, are just touching the ground. They are just flat as pancakes. And over the past 5,000 years, I've been doing different exercises and techniques and strategies to try to improve that, and it's a long story. But anyway, I am on a trend of now working with, past couple of years, a chiropractor buddy of mine, and his wife is a personal trainer, and she's into feet work and ankle stability and foot strength and toe strength and so forth. So I'm on the train of I've got wide toe box shoes. I happen to like Ultra brand, A-L-T-R-A, Ultra, but there are many others. Those are working well for me. I got hikers that have wide toe box, and running shoes and light hikers and so forth. Okay, so you can definitely open up that world to you if you want to. The other reason that I like these particular shoes, and there are many others, not just the Ultras, but many others, is because they're called zero drop. So again, if you're watching me on a video, zero drop means the shoe is of equal thickness in the toe area and equal thickness in the heel area. Most shoes are not that way. Most shoes have a heel, even running shoes, right? Now, those of you that are athletes and runners and so forth, you know that this is a trend now. They're starting to go back to what is called zero drop, so there's no elevation in the heel area. Most of us believe that for most people, that is a good idea. The foot is not designed to be elevated like this, and right now I've got my hand representing a foot, and if it's elevated like this, it's going to shorten the Achilles tendon, shorten the calf muscles. It's putting us in a biomechanical disadvantage and so forth. So two qualities of shoes moving forward, if you can tolerate these, and if you work with your doctor, podiatrist, physical therapist, chiropractor, whoever you're working with, and they agree with this, is number one, a wide toe box. I just think people need to go there first. That's straightforward and simple. You've got to have more room for your toes to open up and spread out. And secondly, start to move towards less of a drop in a shoe, and then maybe to a point where you get to a zero drop shoe. Now, when I said all of those words, I'm not necessarily saying a minimalist shoe. That's another characteristic. That's another quality of a shoe where the shoe base, the shoe last, if you will, the shoe base of it is really thin. I'm not talking about that. I'm not necessarily suggesting that for everybody, although some people do really well with minimalist shoes. So let me back up a little bit. First thing, start moving towards a shoe with a wide toe box. Secondly, if you tolerate this well, go with a minimal drop, which means that the heel is not that much thicker than the toe, or maybe a zero drop shoe, again, if you tolerate that with guidance. And then lastly, some people move to a minimalist shoe where the sole is really thin. You might go there, you might not. Okay. Wow, that was a lot of stuff, but you can go and visit this again and listen to this again as well. Okay, I'm going to get into plantar fasciitis, bunions, neuromas. I'm going to talk about leg length, and then treatments offered in the office, things you can do at home. Before I do that, I'm going to do this before I forget. Dr. Courtney Conley. Dr. Courtney Conley is a chiropractor. She has a specialty in feet and gait. Gait meaning the walking cycle, the run cycle, gait analysis, G-A-I-T, gait specialist. She did a podcast with Dr. Peter Attia in April of 2024. Easy to find. Search it. You'll find it in a second. If you watch this on YouTube, I'll put a link in there as well. They did 2+ hours all about feet. And they were talking not only about the things that I'm talking about today, but much, much more. And they covered also fall prevention in older people. And Dr. Peter Attia asked Dr. Courtney Conley, what is the main thing that people need to do now if they want to reduce their chance of falls when they get older? And she said, toe strength. Wow, right? And even Dr. Attia said, wow, I didn't know that would be your answer. Okay, toe strength, the ability to mechanoreceptively, neurologically recommunicate with your toes to have toe integrity, toe strength, toe power, toe control. And then you get feedback from your toes to your brain, brain back to your toes, and back and forth and back and forth. Opening up that communication system is what she's getting at. Yeah, and that makes sense. What do many of us do, myself included? We stuff our feet in shoes all day and just forget about them and hope for the best. And we might not think about our toes and our feet and our arches and our ankles and stability and strength and so forth until we have a problem, a pain, a neuroma, a plantar fasciitis, a bunion, whatever it might be, right? Hammer toe. So that was very interesting. Podcast is going to be even way more detailed than I'm talking about here today. So consider finding that one. And then if you are inspired, I looked up this today. Dr. Courtney Conley has variety of information available online to do a deeper dive. She has a couple of websites here. One website is called gatehappens.com, G-A-I-T, gatehappens.com. Now, that's more of her shop, and this is cool. So in there, she has packages of things that you can buy for your feet. So some of the things that I talked about, the yoga toes, the multi-toe spacer, the single toe spacers. There's some toe strengthening apparatus in there, bands and so forth. And then I think on there, she's got some courses on there, courses for the public, and then courses for practitioners to up your game on treatments that you can offer to people. So Gate Happens. And then she's based in Chicago as far as I can see. thsclinic.com. T as in Tom, H as in hat, S as in Scott. thsclinic.com. And I'll put links on the YouTube version of that. Okay. On Gate Happens, she has a bunion workshop. Wow, wouldn't that be something, right? Bunion workshop. Here's what you can do at home for your bunions. She has a Feet Fit program. That sounds interesting as well, right? Okay, so that's how you can do a deeper dive. Let's get into a few things here. I'm going to talk about some common conditions that we see in the office and some things that we do in the office and at home to try to make things better for you. Plantar fasciitis. So the plantar fascia is a thick band of tissue underneath your foot that holds things together. It gives structure, integrity, and some elasticity and spring to the bottom of your foot. And boy, does this plantar fascia accept a lot of energy and pressure and power just from the normal walking cycle, the normal gait cycle. But again, we beat the snot out of our feet, and then over time they might break down, and bingo, bango, boingo, we get pain on the bottom of our foot. Now, the classic plantar fasciitis pain is way back by the heel bone. It feels like somebody's driving a nail into your foot. And particularly, that pain can be first thing in the morning when you take your first few steps, it's the worst. And then during the day, if you sit for a while and then you get up and walk again, it's very sharp pain. Usually, again, right near the heel bone. It can be elsewhere in the foot, can be in the big arch in the middle, the medial arch, the longitudinal arch. It can be elsewhere in the foot because that plantar fascia runs from the heel bone all the way to the toes, okay? Well, some people, if you've had this, you know what I'm talking about. On the back side of the heel, on the back side of the calcaneus, you can have tenderness and pain there. Well, there are fascial connections between the plantar fascia on the bottom of the foot, and I know even if you're not looking at me right now, you can envision that thick sheet of tissue underneath the foot. It wraps around the backbone, heel bone of the foot, and then it has attachments to the Achilles tendon. Well, what's the Achilles tendon? The Achilles tendon is the end of your calf muscles. So the Achilles tendon is that thick cord on the back of your leg that then comes up into the calf muscles, and the calf muscles come all the way up to the back of the knee, past the knee, into the femur bone. So if you think about what I just said is, if you've got some trouble way up in the calf muscles, up by your knee, that can translate down into problems down into the Achilles tendon and the fascial connections that wrap around the back of the heel into the plantar fascia. I'm not saying that's the cause, but I'm saying that that is a contributor to having a tightening, unhappy, inflamed, stiff plantar fascia. So part of the remedy there is making sure that we start getting some slow, light, ongoing stretching of the calf and Achilles, the calf muscles and Achilles tendons. Okay? So if you enter physical therapy or a chiropractor that works into this kind of stuff, or massage, or whoever is working with you, they're going to be doing some lengthening of those tissues. Sometimes there's not comfortable tissue work in the calf and Achilles and so forth. Okay. Some treatments that I do in the office for that is low-level laser therapy. Now, laser is different than LED lights, and I've done exposés on that on my YouTube page. Low-level laser, by the way, there are, I believe, 24 FDA clearances for laser use on humans. The very first one that was an FDA clearance was for plantar fasciitis. So the first FDA clearance for low-level laser in humans was for plantar fasciitis. And the reason for that is they would just use light laser on people with plantar fascia, and then they would use a placebo on the next person, and the people receiving the laser got better for the most part. And there we go. So I use my low-level laser on there. I've been doing that 19 years. Secondly, there are feet and ankle adjustments I can do as a chiropractor, and I do those. Not all chiropractors do, but there we go. Number 3, we talked about this earlier, shoe wear matters. Some of you with plantar fasciitis might say, I do well in flip-flops and sandals. Some of you say, oh my gosh, if I wear sandals, I'm in big trouble. I have to wear sneakers. Some of you say, I have to have sneakers by my bed, and I have to put the sneakers on just to walk around, and so on and so on. Okay. So in the acute phase, you do what you got to do to start feeling better again. But as time goes on, you want to go back to the qualities of shoe wear that I'm talking about now, which is wide toe box shoes, getting closer to a zero drop. That's probably going to help you more long term. Number 4 is stretching. We talked about that. Long, slow stretching. If this is allowed or approved or recommended by whoever your practitioner is, you can do very light, slow stretching of your calf muscles and Achilles. And remember, you want to be holding these different positions for long periods of time. We're talking maybe like 2 minutes, okay? 2 minutes, meaning if you imagine me I'm standing, and my hands are against the wall, and I've got 1 foot behind me, and I'm stretching my calf and Achilles, I might hold that for 2 minutes. That's a long time. Remember, if you're in acute phase, make sure it's in the non-painful zone. So it might just be a light stretch. Number 5, you roll your foot on a ball. And by the way, if you go to my YouTube page and you look at one of those two feet videos, feet exercise video number 1 addresses plantar fasciitis mainly, and I show you demonstrations rolling your foot on a ball. I prefer a baseball. You can regulate the pressure, make sure it's not too painful. Some people use a tennis ball, hockey ball, golf ball, and so forth. Number 6, night splint. If you need to look into this, you can get a night splint that holds, and again, I'm showing you if you're watching the video, it will hold your toes close to your shin bone in the front. It will create a light stretch on your foot all night long. The old night splints look like a ski boot, rather cumbersome, not comfortable for a lot of people. The newer ones are really a lot more comfortable. It's almost like a little sock that fits around your lower leg and calf and around your foot with a little piece of Velcro in between that will just angle that foot and put a very light stretch into your plantar fascia, Achilles tendon, and calf muscles all night. That has worked extremely well for some people with plantar fasciitis. And then number 7 is exercises, feet strengthening exercises, ankle strengthening exercises, and so forth. Dr. Conley goes over that. My feet exercise video will go into that, and there we go. Next up, bunions. Okay, we talked about bunions. It's the big toe. The big toe deviates outward. You get this big bulge out to the side. Obviously, the sooner you catch it and take action, the better that the outcome is. What do we do there? Number 1, in my office, I can do adjustments. I can do bony adjustments depending on the tolerance and the sensitivity. Now, again, if you're watching my video, I am grabbing my index finger and I am stretching it along the long axis of the finger. Imagine this being your big toe, and I grab your toe and I pull it outward gently along the axis of the toe bone. For some people, that just holding that stretch is magical for their bunion. However, in some people, if their bunion is advanced and they have a lot of arthritis in that bunion, I can't do that in the beginning. And sometimes we can progress to being able to do it down the road. And that just means that that joint surface is opening up, creating some space, getting some nutrition into that cartilage, stretching out the capsule ligaments and so forth. So we can do adjustments depending on the person. Number 2, again, I can do laser. Some people progress to the point where they need bunion surgery, bunionectomies. I do the laser post-surgery to help the healing process. Number 3, we can do soft tissue techniques in and around the toes and the foot. Number 4 is that toe spacer, the soft gel thing, sometimes 1, sometimes 2, and then the wide toe box shoes is number 5. Wide toe box shoes. Number 6 is called K-tape or kinesiology tape. It's that tape where you can put it on and leave it there for a few days and then take it off if you need to. The tape that has stretch but it stays sticky. There are certain ways, if you can imagine, again, I'm showing you visually right now. If the toe is deviated, you can tape it along the inside of the foot, maybe along the arch, and just kind of guide that big toe to go outward like this. Okay, so there are K-taping techniques. If you look on YouTube, there's a lot of really good videos on how to tape that toe. This also includes turf toe. Turf toe is when you actually injure or sprain that big knuckle in the big toe. And a lot of these procedures I just mentioned are very good for turf toe as well. And then there are feet exercises and so forth that we're talking about. So that's what we do with bunions. We're certainly not going to prevent all people from needing surgery with bunions, but I've taken people and really seen them turn around to a point where they're quite good for many, many years. Next is neuromas. Now remember, neuromas is that word to describe the growth of scar tissue around the end of the nerve endings in between the toes. So it's typically between the second and the third toe. It can be between the others. And it rubs, and so forth. Okay, so our solutions there, again, I can do joint adjustments as necessary in my chiropractic office. We do soft tissue techniques. Oftentimes, we have to get in there and manually work out the tissues. And there's a variety of ways to do that. You can do it in the office. You can do it at home. There are ways to do it at home, and I show people how to do that. Next is toe spacers. As you can imagine, toe spacers with neuromas is really critical because you want to open up a little bit of space between those knuckles to prevent that friction from reoccurring. Wide toe box shoes, feet exercises, you can kind of see what the consistent solutions are here with these different feet issues are. Okay, and this last one I wanted to mention to you is, it's related. I call it leg length analysis and leg length discrepancy, or it's also called LLI, leg length inequality. Okay, this is literally when one person's leg is shorter than the other. And when I say this, it is a structural phenomenon. The leg bones on one side are longer than the leg bones on the other side, okay? Which is the main cause. There can be some scoliosis issues up higher that can cause leg length discrepancies. But we're talking about an anatomical one. Now, as I say that, some of you that have experienced this, or if you're a clinician, you know that there are what are called physiologic leg length discrepancies. So somebody might be lying on a table, a treatment table, face down, face up, whatever it is, and you can visually see, wow, this one leg's short, one leg's long. But then you do some techniques and you're able to change that, because it's more of a nerve and soft tissue and muscle tightness problem that's hiking up one hip and the other side is more relaxed. That's a physiologic one. I'm talking about an anatomical structural leg length discrepancy where we have somebody take a standing x-ray and we measure the top of the femur heads and one is off compared to the other. That can also happen after a joint replacement surgery, like a hip replacement surgery or a knee replacement surgery. Now that person might not have had a anatomical leg length discrepancy, and now they do. So I watch for that. Other clinicians watch for that. Therapists, chiropractors, orthopedics, and so forth. Now, with that said, I've whipped magic on people by giving them a $3 heel lift. And we test it out. This should be done under someone who has experience. And we might start with a little bit of a sliver. I tell people it's kind of like a carpenter who's trying to level a board. They put the level on there and they see, oh, it's off. It's a structural problem with the wood here. So what I'm going to do is I'm going to put in a little wedge and then recheck the level. And if it's still off, I'm going to put in a little bit more of a wedge until that wedge is just right. And if you put in a wedge that's too thick, whoops, it went over to the other side a little bit. You take that one out, put in a thinner one. You see? So it's experimentation. Now, with that said, I'm just going to make up a scenario. We see a structural leg length problem in somebody. It doesn't get corrected with our treatments, adjustments, soft tissue work, physical therapy, massage work, acupuncture, whatever it is. It's a structural leg length, okay? That does not mean that the person will necessarily respond well to a heel lift. So that's when we experiment. We might start with a little sliver, give them a couple of weeks, see how it goes. Maybe another sliver, see how it works. I've done this with hundreds of people, and when it works really well. Okay, why am I mentioning this on the foot deal? Because on the long leg side, this is a generalization. This is not a rule, generalization. If somebody has a structural long leg on one side, we tend to have more issues on the long leg side. And again, if you're watching me visually right now, I'm bringing my hands together like compressing something down. The long leg is under more compression, so we tend to have more feet, ankle, knee, hip, back, and so forth problems on the long leg side. Not in all cases, but it happens consistently enough to be worth a mention here in this show. It's something that I look for, and something if we need to take a correction for, like a permanent heel lift, which means you just have a heel lift in all of your shoes. When it works really well, and I won't get into the cases. I've done this in other shows where I've done that. I've seen that happen. So with that said, when people have a bunion on one side, an ankle problem on one side, a knee problem, hip problem, back problem on one side, that might be a contributing issue. So we need to take action for that if we see it. That's why I'm mentioning it to you. Okay. So as a review, the treatments that we offer and what we do is when we're going after these feet, ankle issues like the bunions, like the neuromas, like the plantar fasciitis, like the turf toe, ankle instability problems, fallen arches, whatever it might be. I've got laser, low-level laser therapy. I have a magnet table in my office. My magnet table works very similar to electrical muscle stim, but it's using a magnetic field instead of electrical pads. So I use that on rehabilitation of muscles and nerves and joints around the body. So this is a fascinating therapy that I've had for a few years now. And you can go to this website. It's called React Innovations. React isn't reacting to something. reactinnovations.com. And of course, I have the links on my website and my YouTube page and so forth. So we're using a magnetic field to activate nerves and stimulate muscles and bring some rehab back into these areas. Next is we do the adjustments when necessary if there's joints that need that. Next, the fourth one down is K-tape or kinesio tape or kinesiology tape. It's always nice to work with somebody that has experience with K-tape, kinesio tape. Chiropractors do, physical therapists do, acupuncturists might, orthopedics might have that, trainers might have experience with that, okay? Number 5, this is just so important, is moving toward and starting to select wide toe box shoes. Number 6 is you might want to add on a zero drop shoe, getting that heel thinner, okay? And then of course number 7, and we all need to be doing this, is feet exercises. I have my videos. Dr. Conley has training as well. When needed, we have, number 8, it would be toe spacers. So we have, again, singular toe spacers that might go between the first and the second toe. If somebody has enough space and they need to move that big toe a little bit further, they put a second spacer between the second toe and the third toe. When you're at home and then you want to space them all, you get a yoga toes or your yoga toes look-alike and try to space all of those toes apart. This is incredibly important information for your children when your children are coming up. Having children spend time in bare feet, if they can be doing that safely. Lots of bare feet time. A lot of people think that that is a good deal, a good situation, a good foundation for them, because they are going to develop the strength and muscles not only in the bottoms of their feet, but on all of the guide wires that are running up that lower leg to the knee and past the knee and so forth. So the inside of the lower leg, the outside of the lower leg, all of those tendons, muscles, and all of that neurological input and output is just going to be set up in a good foundation with kids. So a lot of out of shoes time, again, if it can be done safely, will really help kids. Dr. Conley talks about this a lot. So I think that that's important as well. Hopefully you get something out of some of the common feet ailments that many of us have. I wish you well. I'm Dr. Scott Fuller. Please join me again. Thank you for listening to A Fuller Life podcast. For a video of this podcast, go to my YouTube channel, Dr. Scott Fuller, which has a lot of additional content.